Today we're going to talk about aorta anatomy and protocol. This is chapter 8 in your Hagen Ansert book, and we're just going to do a quick review of the circulatory system and then work our way right into aorta. So the function of the circulatory system is to transport gases, nutrient materials, and other essential substances to the tissues, and then transport waste products away from the cells and to the appropriate sites for excretion. Let's talk about the path or the journey of a blood cell. All right, so we're going to start in the left ventricle of the heart. Blood is going to be pumped out of the left ventricle through the aortic valve and into the ascending aorta. From here, it's going to go to all the other arteries in the body. The aorta is sort of like your superhighway. Okay, so it's going to travel through the ascending aorta to the aortic arch, and then down the descending aorta to the diaphragm, where it's going to pierce the diaphragm and become the abdominal aorta. The abdominal aorta is what we're going to primarily be talking about today. From here, there are going to be several branches called arteries. The arteries are going to branch into even smaller arteries called arterioles. Those arterioles are going to branch even more into a capillary bed. The capillary bed is going to have an arterial side and a venous side. These capillaries can be as small as one red blood cell in diameter, so only a single red blood cell will go through at a time. On the venous side, once we've gone through the capillary bed, we're going to see those venous capillaries come together to form venules. The venules are going to come together to form veins. These veins are going to all dump into the IVC from the lower part of the body, and from the upper part of the body into this SVC. The IVC is going to travel upwards to the diaphragm, pierce the diaphragm again, and it's going to enter the right atrium of the heart. This is also where this SVC, the superior vena cava, is going to dump into the right atrium of the heart. From here, blood is going to go through the tricuspid valve into the right ventricle of the heart. From the right ventricle, it's going to be pumped through the pulmonary valve into the main pulmonary artery. And this is going to branch into a right and left pulmonary artery and go to the lungs, where the blood is going to be reoxygenated and return to the heart through the pulmonary veins to the left atrium. From the left atrium, it's going to go through the mitral valve to the left ventricle, and the whole system is going to start over again. All right, now your arteries and veins each have three layers. The arterial side is going to have a thicker tunica media. This is the middle muscular layer, and the vein is going to have a thinner layer of the tunica media. Okay, your tunica intima is going to be the interior layer. It consists of the endothelial cells that line the arterial passage, or the lumen of the artery. It's going to have connective tissue and then an elastic layer that's made up of elastic fibers. As we said, that tunica media is your muscular layer. It's going to consist of elastin, smooth muscle fibers, and collagenous tissue. And the tunica adventitia, the external layer, is a loose connective tissue layer with bundles of smooth muscle fibers and elastic tissue. This one's going to carry the nerves and the vasa vasorum. The vasa vasorum are tiny arteries and veins that actually supply blood to the blood vessel itself. Okay, so here they are. You can see that tunica media in the artery is much thicker. This is to allow the artery to tolerate higher pressures, because remember, the arterial side of our circulatory system is the high pressure side, the venous side is the low pressure side. All right, let's dig right into the aorta. The aorta is going to be the largest artery in the body. As we said, it's sort of the superhighway. Okay, it's going to be divided into 5 sections. The aortic root, this is the section of the aorta that joins to the heart right at the aortic valve. And then we're going to have the ascending aorta and the arch. It's going to come up out of the left ventricle, arch over, and head down the left side of the heart That's going to be your descending aorta. The root, the ascending aorta, and the arch are all part of the, the root, the ascending aorta, the arch, and the descending aorta are the thoracic aorta. As I said, that diaphragm is going to separate the aorta into the thoracic section and the abdominal aorta and branches, but I want you to remember it is all one vessel. Okay, and then at the terminal end, we're going to have the aortic bifurcation. Okay, so we said it's the largest artery in the body. It supplies the blood to all of the visceral organs and to the legs. This is the abdominal aorta. It's going to be anterior and to the left of the vertebral column. So it's going to run down your left side, right in front of the vertebrae, the spinal column, and on the right side, that's where the IVC is going to come up. It will be posterior to the left lobe of the liver, the body of the pancreas, the gastroesophageal junction, the pylorus of the stomach, and the splenic vein. Okay, it's going to run posterior to all of those things. And there are a number of branches in there that we're going to look at. All right, normal diameters. Normal diameters. If you just remember that anything from 2 to 2.7 is the normal diameter for the aorta, you'll be in good shape, okay? It's a little bit smaller in women than it is in men. It tends to get smaller as it gets closer to the terminal branches of the iliac arteries. And you want to also remember that there's a kind of a gray area there, 2.7 to 3.0, where we consider the aorta dilated, but maybe not necessarily aneurysmal. But an aortic aneurysm is going to be defined as any diameter over 3 centimeters or a noted focal dilation. So if it's smaller in a woman and it's around 2 and all of a sudden you've got a section that's 2.6, that's a big enough difference that you should take note of it. All right, I'm going to pause here and give you a moment to really look at this slide, see if you can name all of the branches of the aorta, and then we'll come back and we will talk about that. All right, let's see how many you got right. We're going to start up there where it says crura. That's the crura of the diaphragm that you're looking at there. And we're going to work our way down the left side and up the right side. Now remember that you want to think of this is just like sonography, okay? The right side of your screen is the left side of the patient's body. So when I say I'm going down the left side, I'm going down the left side of the patient's body, which is going to be the right side of your screen. So we're going to start right there at the top in the middle. That's the celiac trunk. As we go down, the next one down is going to be the left renal artery, then the left gonadal artery. You're going to see a number of lumbar arteries next. Those are those 4 that are lateral and behind the left gonadal. And then as you get down to the bottom, you're going to see the left iliac artery. That's the common iliac artery, left common iliac artery. Hanging down there like a little tail, that's the middle sacral artery. And then we're going to come back up on the right side. We've got the right common iliac artery. We have the inferior mesenteric artery, the right gonadal artery, the right renal artery, and then just below the celiac trunk, that topmost one on the right side for the patient, that's going to be the SMA as far as your boxes go. Okay, so let's talk about those in a little bit more detail. We're going to start at the top with the celiac trunk, also known as the celiac axis. And off the celiac trunk, you're going to have 3 branches. Okay, the 3 branches are going to be the common hepatic artery, the left gastric artery, and the splenic artery. All right. The common hepatic artery is also going to split into the proper hepatic artery, the gastroduodenal artery, and the right gastric artery. So it branches off of the celiac trunk and then immediately starts to branch again. The superior mesenteric artery is going to be the second anterior branch of the aorta, and the inferior mesenteric artery is going to be the third anterior branch of the aorta. So going down from superior to inferior, the anterior branches of the aorta are the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. Okay, the common hepatic artery is going to course to the right at almost 90 degrees. Off of it, we're going to see the proper hepatic artery. This courses into the liver through the porta hepatis. It's part of the portal triad, along with the portal vein and the common bile duct. And it's going to supply supply blood to the liver. It will branch once inside the liver into the right and left hepatic arteries. The gastroduodenal artery courses along the upper border of the pancreatic head. It runs behind the peritoneal bursa to the upper margin of the superior portion of the duodenum. So what that means is it's going along the head, behind the bursa, and it's going to supply also that upper part of the C-loop of the duodenum. Along with the right gastric artery, it's going to supply the duodenum and also parts of the stomach. The left gastric artery courses anterior, cephalic, and left to reach the esophagus. So as you're thinking about this, you're going to be thinking about where these go. One of the best ways to remember where all of these go is to actually get out some Play-Doh and build yourself an aorta and a celiac trunk. You can also draw them out several times, and that will also help you kind of get the lay of the land, so to speak. Okay, so once it reaches the esophagus, it's going to descend along the lesser curvature of the stomach, and its job is to supply the lower third of the esophagus and the upper right of the stomach. Now the splenic artery, it's going to be the largest of the three branches. It's going to turn and go left horizontally along the superior border of the pancreas. It supplies the pancreatic body and tail, the spleen, and also the fundus of the stomach. This is a very tortuous, long vessel that has a number of branches as it heads towards the spleen. Okay, again, I'm going to have you pause the video here and see if you can name all these branches, and then we'll come back and we'll take a look and see how many you got right. Okay, let's see how you did. We're going to start right here with the aorta. So this box up here should say aorta. The next one down, that's that celiac trunk that we talked about. As we move to the patient's left, that trunk we said was going to branch. It's going to branch into the splenic artery. You can see it here, nice and long, tortuous, and with many, many branches. Over here, we have that common hepatic artery. You'll recall I said the common hepatic artery branches again fairly soon after it comes off the celiac trunk into the proper hepatic artery right here. This one's going to come up and branch into right and left hepatic arteries and head into the liver. This one here, this little branch off the left, that's going to be your middle hepatic artery. Right here, off kind of with the right hepatic artery, you're going to see this little one. This is the cystic artery. This one supplies the gallbladder. Okay, and then of course we said common hepatic artery, proper hepatic artery. There were a couple other branches to that proper hepatic artery. You remember we talked about the right gastric artery, that's this little guy right here, and the gastroduodenal artery, which heads inferior right here. That's your gastroduodenal artery. Now we got this little guy right here too, don't we? This one is the supraduodenal. That's your supraduodenal artery. It's going to run along the top of the duodenum. And then we said there were three branches off the celiac trunk. That's 1, 2, and this third one heads up this direction. It's going to head superior and then turn and go left. That is your left gastric artery. How'd you do? All right, so I just wanted to give you a little quick picture of what this looks like sonographically. So this is a transverse image. You'll see there's left liver up here. Left lobe of the liver is up here at the superior portion of your image. You got your aorta in transverse down here. And then we've got that celiac trunk coming off of it. We can see the splenic artery taking off to the left, the hepatic artery taking off to the right. We do not see the left gastric artery in this view, but this view here is called the seagull view. This is the seagull sign. It's going to be the celiac trunk, the splenic artery, and the hepatic artery, common hepatic artery. Okay, in sagittal, you're going to see that aorta as a tube along the bottom of your screen, right in front of the vertebral column. This bright wavy line down here is the vertebral column. Again, you're going to have left lobe of the liver in your picture up here. And you're going to see two branches off of here. You're going to see that celiac trunk that we talked about, that anterior branch, the first anterior branch of the aorta. And the second anterior branch of the aorta should be visible as well. That's the superior mesenteric artery. Okay, so since we're on that, let's go ahead and talk about the superior mesenteric artery. All right, your superior mesenteric artery is going to come off of the abdominal aortic wall about a centimeter inferior to the celiac trunk. Everybody's built a little bit differently, so that distance can vary a little bit, but you should be able to see both of them in that sagittal view that we just looked at. The superior mesenteric artery courses posterior to the pancreatic neck. It's going to be anterior to the uncinate process. Okay, so the pancreas is going to wrap around that superior mesenteric artery. All right. Now the superior mesenteric artery is going to have 5 main branches that supply the small bowel. All right. When you think about what vessels supply which parts of the body, you want to think of that celiac trunk as supplying the spleen, the liver, the upper part of the duodenum, and the pancreas and stomach. And then you want to think of the superior mesenteric artery as supplying most of the small bowel. Okay. And then when we get to the inferior mesenteric artery, you want to think of it as supplying sort of the large bowel. All right. That's not a perfect division, but if you keep that kind of in mind, superior mesenteric, small bowel into the right, inferior large bowel into the left. All right. So your 5 main branches of the superior mesenteric artery are going to be the inferior pancreatic artery, the duodenal artery, the colic artery, the ileocolic artery, and the intestinal artery. Okay, there's that picture again. You can see that celiac trunk, and then you can see the SMA coming off of that aorta just slightly inferior to it. All right, and with color Doppler, it's going to look like this. Again, we've got that aorta, celiac trunk, superior mesenteric artery. Okay, in transverse, what you're going to see is you're going to be slightly lower than where you were to get the seagull sign. As you move inferior on your patient, you're going to see that superior mesenteric artery as its own little circle anterior to the aorta, and it's typically surrounded by a bright ring of tissue, of connective tissue. In front of it, you should see the splenic vein running behind the pancreas. So here's part of that pancreatic tail and body, just a little bit of it. We can see a little bit of the head. Splenic vein here. It'll turn into the portosplenic confluence and head into the liver as the portal vein. Down here we got the IVC. We can see a little bit of that left renal vein right here. And then we got the aorta right here. And this one here is your SMA. Okay, inferior mesenteric artery. Inferior mesenteric artery. It's going to come off the anterior abdominal aorta right around the level of the third or fourth lumbar vertebrae. It's going to course a little bit left, so it doesn't run straight down parallel. It runs a little off to the left. It supplies the left transverse colon, the descending colon, the sigmoid colon, and the rectum. You'll recall I said to think of the superior mesenteric as small bowel and to the right, and then inferior mesenteric as serving the left side of your abdomen. Okay, and again, it's not a complete, discrete, clean division, but it will help you keep things separated a little bit. Your branches off your inferior mesenteric artery are going to be the left colic artery, the sigmoid artery, and the superior rectal artery. Okay, that takes care of our anterior branches. Remember, our anterior branches from superior to inferior were the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. Now we're going to talk about the lateral branches. These are the ones coming off the sides. We're going to start at the top again. At the top, we have the phrenic arteries. These are small vessels that come off the lateral aortic wall. They supply the underside of the diaphragm. Okay. Next, we're going to have the renal arteries. They're going to arise from the aorta roughly at the first lumbar vertebrae. You should see them pretty much at the level of the SMA as well, in that same general area where you would see the SMA. Okay, they're going to be slightly lower than that. And the right one is going to course posterior to the IVC, anterior to the vertebral column, and posterior to the right renal vein. The left one is shorter than the right one because the aorta is on the left side of the body. So the left one has a shorter distance to go to get to the kidney. It's going to course directly into the left renal hilum. That left renal artery straight in, the right renal artery wraps behind the IVC. So think of the IVC and the aorta as two partners dancing together. Okay, so the aorta's got his arm around the IVC's back on the right side. And then you've got the gonadal artery, considered a lateral branch. Is sort of an anterolateral branch. It's going to come off inferior to the renal arteries. They're going to course along the psoas muscle on either side to the respective gonadal areas. You're going to have a right one and a left one, and they're going to be lateral and slightly anterior. Okay, so that brings us to the terminal end of the aorta. The distal aorta is going to bifurcate into the right and left common iliac arteries, somewhere around the level of the fourth vertebrae, and it's going to be superior to the umbilicus. Okay, so if you're looking for that bifurcation in transverse, you want to be slightly above the belly button with your transducer. You're going to find it right around there. The common iliac arteries divide into the internal and external. The internal iliac arteries, they're going to enter the pelvis and divide into anterior and posterior branches and supply all of your pelvic organs, the pelvic viscera, the peritoneum, the buttocks, and the sacral canal. Now your externals are going to course down next to the psoas muscle along that medial border. They're going to pass under the inguinal ligament and become the common femoral arteries. So on the left side, your left external iliac artery becomes your common femoral artery. On the right side, your right external iliac artery becomes your common femoral artery. Looks like this. All right, we're still in sagittal here. We got that aorta and we got the right and left iliac arteries. Now, I don't know which one is which. I don't know if this is the right one or if this is the right one, because I don't know what the person taking this picture, what their approach was. Okay, so your approach means they either came to the right side of the patient or the left side of the patient to get this picture. and the one closest to your transducer is going to be the one closest to whichever side you're on. So if they took this picture from the right side, then this is your right common iliac and this is your left common iliac. If the transducer is off to the left pointing back at the aorta, then this is the left common iliac and this is the left or the right common iliac. So it's all dependent upon your window. Okay, so that takes care of the anatomy. Our lateral branches then are the phrenic arteries, the renal arteries, the gonadal arteries, and then the terminal branches, the common iliac arteries. Okay, so now you have all the branches of the aorta. You have most of the anatomy of the aorta at this point. I'm going to take just a few slides and talk about the protocol. Okay, you've seen the pictures. I've already shown you those. So we're just going to run through it quickly. Plus, all of you should be doing these already. This is a basic protocol that will get you by at almost any place that you go to. They may ask you to add some pictures or do some pictures a little differently, depending on the protocol that the radiologist wants. Okay. In sagittal, you want to start at the top. You want to get a proximal at or above the celiac axis. You want a mid at the SMA/renal level. You should see that splenic vein. You might see the renal arteries taking off. You should see the SMA in your picture. Distal, you want to be below the renal arteries but above the bifurcation. My favorite thing here to do is just to keep sliding down, survey that aorta as you're going down, and somewhere between where you see the renal takeoff and the bifurcation, that's going to be your distal. At the bifurcation, you want to see the distal aorta and the proximal common iliacs. Also in sagittal, at some point, you want to see the IVC and put color Doppler, get a picture of it with and without color Doppler. In transverse, we're going to start again at the top, proximal at or above the celiac axis. The mid is going to be at that level of the SMA again. And distal, you want to be at or below the renal levels. Again, here what I do is come all the way down to the bifurcation and then just slide back up a little bit and get a diameter there, because that's where typically you're going to see a aneurysm. We're going to talk about aneurysms in another video. And then you want a picture of the bifurcation. Okay, you're going to measure at a minimum in an AP in sagittal. So at each of those levels we talked about on the sagittal, you're going to take a measurement anterior to posterior. AP at the prox, AP at the mid, AP at the distal, and then an AP of each of the common iliacs. Some places are also going to want you to take those same measurements in transverse. So in transverse, you would do that across your screen, not up to down. Okay. And then, of course, if an aneurysm is present, you've got more pictures to take. You need to document the location, the length. You want to take AP and trans measurements, and you want to put color and pulse wave Doppler on it. Okay, so let's take a quick look through them. Here's your sagittal images. Here's our celiac trunk. Here's our proximal aorta. If we were going to get an AP measurement, we would probably do it like this. We'd start here and measure down. You want to include the wall in that, not just the lumen. Okay, I'm not terribly accurate because I'm using PowerPoint, all right? And then for your distal, for your mid, right, we got this SMA right here. Our renal arteries we can see right here. So that mid is going to be somewhere in this area right here. Remember, we said we wanted to be above the renals. So we do an AP measurement there. Whoop. Not terribly straight and accurate, but you get the idea. Distal, we want to be below those renal arteries. So here's our distal with the iliac bifurcation. You can see they've already measured the iliacs here. So all we would need is our measurement of the distal in AP. Okay. Keep in mind, as I said, I'm not terribly accurate because I'm drawing with a pen on a PowerPoint. So make sure you include those walls. Okay, and then in transverse, all right, in transverse, we want that proximal again. Okay, we can see the celiac trunk there. We want to be at or above the celiac trunk. This measurement's not terribly straight, but I'll take it. We want a mid Here's our mid. Okay. Here's our proximal down here. Sorry, these appear to be in out of order. My apologies for that. Proximal's down here. Okay, that makes more sense. I'm liking that better. So here's our proximal with our measurement. Here's our mid with the SMA present. Okay. And then and the distal. And then this last slide shows you that grayscale of the bifurcation. These are your right. Here's your right. Here's your left. Common iliacs. You want a grayscale image. You want one with color Doppler. And I typically will throw a caliper on there as well and get a transverse of each of the iliacs. It helps if you, that one's really not straight, but okay. It helps you if you label these for the radiologist. All right, that concludes our video on the anatomy and protocol of the aorta. The next video will be on pathology. Thank you. You have a good day.